My name's Jonathan Craig. I'm the Executive Dean of Medicine and Public Health, and it's my great pleasure to welcome you all to the annual Southgate Oration. This is the 12th year, and we're delighted to welcome the 2020 Australian of the Year, Dr. James Muecke AM. We're also delighted to welcome members of the Southgate family, Mary Mooney, Kevin Mooney, Sam, daughters Kathy and Anne, but unfortunately they're unable to be here in person, although I'm sure they are online due to the Victorian COVID restrictions. Also very delighted to welcome Chris Picton, MP. Hey Chris, Shadow Minister for Health and Wellbeing. I know that you're a strong supporter of Southgate and your attendance here is much appreciated. Also Deane, Chief Executive of Wellbeing South Australia. Lincoln Size, CEO Cancer Council of South Australia, and Uncle Lewis Yellowburka O'Brien. And I'd like now to invite Uncle Lewis to the stage to deliver the Welcome to Country. Thank you, Uncle Lewis.
Marawachanga, Ghana Mira, Nawangani, Mani de Bunigani Yatana. Naibiriko, Mankalagala, Tandanya, Mianaku. Nature Yungandalia, Nature Yakandalia, Padni Adlu Wadu. On behalf of the Ghana people, I welcome you all to Ghana country, and I do this ambassador of the Adelaide Plains people. My brothers, my sisters, let's walk together in harmony. Natalia.
So I too would like to acknowledge that we're on the traditional lands of the Ghana people, and I'd like to pay my respects to elders past, present and emerging. But note, as Flinders, we've got a very large footprint across a lot of South Australia and Northern Territory, and I want to acknowledge the traditional custodians for all of those lands, and also to acknowledge Aboriginal and Torres Strait Islander people who are here in person and also online. I'd also now like to invite Professor Fran Bohm, AO, to say a few words about Deane Southgate. Professor Bohm would be known to many of you, but she's a Matthew Flinders Distinguished Professor of Public Health, the Foundation Professor of Southgate Institute for Health, Society and Equity, and Director of the WHO Collaborating Centre on the Social, Political and Commercial Determinants of Health at Flinders University. Fran.
It's a bit of a mouthful, Jonathan, but never mind. Well, good afternoon, everybody, and also to the people who are live streaming. We have this lecture every year, and it reflects the name of our institute, the Southgate Institute. But Deane Southgate, and we're sort of getting further away from when people remember Deane, but of course he was the head of department of primary care and community medicine in the School of Medicine. And I guess when we looked for a name for the Southgate, we wanted someone who had left an amazing legacy, and Deane had certainly done that. In his career, he was involved in public health, health promotion, and of course community medicine and general practice. He was the person who, at his Southern Clinic, which is still there, the clinic on South Road at Clovelly Park, he jumped at the chance to establish a community health centre there in about 1974, one of the first in the country, and he was director of that for a long time. And I think at the Southern Clinic he worked there from 1955 until his death, so he really put in a long haul there. He also saw, as well as establishing the Community Health Centre there, he was the first president of the South Australian Community Health Association, which did so much work to nurture and support what we did have as a network of community health centres in South Australia. And of course his general practice in that area of Clovelly Park was an area where there was a lot of light industry, so he also developed a real interest in occupational medicine, kind of looking at a social determinant of health. And because of that, he became very involved was one of the pioneers of the Australian College of Occupational Medicine, and he was also a medical officer to the mobile Esso refinery down at Port Stanvac, and that Clovelly Park Community Health Centre used to offer a lot of occupational health services to the light industry. So I think you can see why Deane was such a good person for us to name our institute over. The other thing he did was he was heavily involved in establishing the Service to Youth Council, which still continues and provides lots of services for young people. And of course, we're very pleased that Mary and Kevin and grandson Sam can actually be with us today. That's really fantastic. And I think Mary and Kevin, you've been to just about every Southgate Oration, or just about all of them. So this is the 12th, and it's very much a recognition of Deane's legacy and also of the work we continue to do.
Thank you, Professor Baum. So that, I think, provides a fabulous introduction into a brief introduction for tonight's orator. Following the oration, there will be an opportunity for questions for those in the room. There are microphones in each aisle to ensure those joining online so that everyone can benefit from your questions. Please use the one closest to you. For those joining online, please select Ask a Question via your Microsoft Teams live screen. And after the last 6 months, I'm sure that you'll be very adept in using Teams or similar. So it now gives me great pleasure to introduce our Southgate orator for this evening, Dr. James Muecke AM. Dr. Muecke completed his medical training in Adelaide, and following his internship, he lived and worked as a doctor in Africa and subsequently as an eye surgeon in the Middle East, battling malaria, wild animals, and rebel soldiers. He founded Sight for All in 2008, turning his boundless energy into a fight against blindness in the Aboriginal communities of Australia and some disadvantaged communities in Asia and Africa. His commitment to social impact and humanitarian endeavours has earned him a string of awards, including the Order of Australia in 2012, the Australian Medical Association President's Leadership Award in 2013, Ernst & Young's Social Entrepreneur for Australia in 2015, and the University of Adelaide's Distinguished Alumni Award in 2019. Dr. Muecke is a very interesting person. Not only a researcher, teacher, but also an author, a musician. I'd be interested in knowing a little bit more about that. A photographer, a film producer, and uses his many skills to deliver passionate, fascinating, and at times confronting presentations about his life, his work, philanthropy, resilience, and social entrepreneurship. On being appointed the 2020 Australian of the Year, Dr. Muecke immediately advocated for a tax on sugary drinks in the fight against type 2 diabetes. Please join me in welcoming Dr. James Muecke.
Thank you very much, Jonathan, for a kind introduction. Thank you to Fran as well for inviting me to give the Southgate Oration, and it's a real honour to be the orator for 2020, and lovely to meet Deane Southgate's family. It's a wonderful legacy and lovely to be a part of this, so thank you so much. It's actually really nice to be giving a live presentation. It's a rarity this year. In fact, in that first couple of weeks after receiving the award, I had a year of speaking engagements booked up almost every single weekend. I had something like 60 in that first couple of weeks, and when the pandemic struck, one by one they all got crossed off, and this is about my 6th live presentation for the year. Most of these have happened in the last month or so. So it's really nice to get out from behind Zoom, take my pyjama bottoms, my Ugg boots off, and actually put on a suit. So it's wonderful to be here and to talk about my presentation today, Blinded by Sugar. I'm not going to be talking about being captured by rebel soldiers and wild animal attacks, so I'm going to be talking about something even more dangerous, actually. So it's also really nice to be back here. I haven't been to Flinders since, well, I started my ophthalmology training 30 years ago, so it was my 3rd year of ophthalmology training, so probably 28 years since I've been here at Flinders, so it's really lovely to be back here and be a part of this, so thank you very much. So 30 years in ophthalmology, and for 30 years I've been dealing with the consequences that diabetes inflicts on the eyes. Every year, I'm seeing more and more patients who are losing their vision, even going blind due to diabetes. In particular, type 2 diabetes, which makes up close to 90% of all cases and is a largely preventable dietary disease related to the consumption of too much sugar in our modern diet. Can you even begin to imagine waking up one morning completely blind? Impossible to comprehend, isn't it? Well, one of my patients had exactly that experience. His name is Neil Hansel. Everyday Aussie bloke, a wife and 4 kids. He constructs light machinery for a living, and he also has type 2 diabetes. And a few years ago, at the age of 50, diabetes changed Neil's world forever. Unfortunately, he'd neglected his disease, and he paid the price. He went to bed one evening with normal sight and woke up the next morning blind in both eyes. One of my retinal colleagues worked really hard to try and retrieve his sight. Unfortunately, it was too late. Neil was to spend the rest of his life in darkness. This is how Neil sees the world these days.
Basically, I think I would describe it as seeing everything as as emotion, not as an actual vision. The images, unfortunately, aren't clear. The images are basically what you see of a day through your eyes is what you see of a night through your eyes. So there's no clarity. I see black figures as people or animals or trees, just black, onto a greyish background.
So Neil lost his driving licence, he lost his independence, and he lost his ability to teach the javelin, which was his hobby. In fact, it was a passion that gave him incredible joy. But the thing that upsets Neil the most is that he can no longer see the beautiful smiles on the faces of his wife and his grandkids. This is a picture of Neil's wife and 2 of his grandkids. This is how he should see them, and this is the reality. Neil has been irreversibly blinded by sugar. And Neil is not alone. He's just one of over 100,000 Aussies with sight-threatening eye disease due to diabetes. So how does diabetes threaten the sight? For those of you who don't know, diabetes causes damage to the blood vessels throughout the body, including the retina, which is the light-sensitive layer of tissue that lines the inside of the backs of our eyes. This is a picture of the central vision area, what we call the macula, in a patient with type 2 diabetes. And this is that same eye a short time later. Diabetes can cause bleeding inside the eyes that can take away the eyesight in an instant and sometimes permanently. The important point here is that nearly all of the loss of vision and blindness due to diabetes is preventable or treatable, something like 98%. And yet, to avoid the blinding consequences of this disease, patients with diabetes need to have their eyes checked on a regular basis. In Australia, of the 1.7 million Aussies with this disease, well over half are not having their regular, all-important, sight-saving eye checks. And that's why it's now the leading cause of blindness amongst working-age adults in this country. It's also the fastest-growing cause of vision loss in Aboriginal people. So for me, as an eye specialist, to see people going needlessly blind due to diabetes, it makes me upset. But the thing that makes me really angry is we should not be seeing this disease at all. This was a disease that was virtually non-existent in the 60s. These days, we have roughly 250 new cases in Australia every single day. So this evening, I'm going to talk to you about type 2 diabetes, how it's arisen, why it's a growing epidemic, and look at some strategies to curb this rising tide of a disease that's a serious threat to our society and to our health system. So I mentioned that it's a largely preventable disease related to the consumption of too much sugar in our modern diet. And when we talk about sugar, we often think of table sugar, what we add to our tea and coffee. But it's important to remember there's another very abundant form of sugar, and that's the refined carbohydrates. Products such as white flour, white rice, white potatoes, and the foods made from these. So refined carbohydrates are pretty much pure starch, and starch is simply long chains of glucose which is broken down into glucose when it reaches the gut. So we're ingesting refined carbohydrates, we're pretty much ingesting pure sugar. And it's important to remember that sugar, and particularly refined carbohydrates, are nutrient poor and non-essential. There's not a biochemical process in our body that demands that we ingest sugar in our diet. And yet, our Australian Guide to Healthy Eating, which is based on our Australian dietary guidelines, is packed with products made from refined carbohydrates. Products such as white rice, there's a variety of breads and pastas, and of course white potatoes. And there are also a number of other products which have relatively high amounts of sugar in them. Tropical fruits, low-fat dairy, baked beans, processed food, just for example. So let's go back to sugar. So sucrose, the table sugar, is made up 50% glucose and 50% fructose. And the body handles these two substances in completely different ways. So let's look at them each in turn. So firstly, glucose. When glucose is absorbed into the bloodstream from the gut, it triggers the release of the hormone insulin from the pancreas. And the insulin helps move the glucose into every cell of our body, whether it's either stored or used as an energy source. When I talk about glucose metabolism, I like to use the analogy of a subway train in Tokyo, where the train car is the cell, the passengers are the glucose molecules, and the subway conductor is the insulin. With excessive and prolonged sugar intake, the cell becomes full of glucose. The insulin level rises to help try and push more glucose into the cell, but it reaches a stage where it can't push any more in. It's when we become what's called insulin resistance. There's an overflow of glucose back into the bloodstream, which is taken up by the liver and converted initially into glycogen. The glycogen stores are limited, and once they're full, the liver starts turning the glucose into fat, which is then exported away from the liver and stored in healthy fat cells around the body. It's actually a protective mechanism. But when the production of fat by the liver outstrips its ability to be exported, the liver then starts taking on that fat, and we develop what's called a fatty liver. This is a picture of the fatty liver of a human. Normally the liver is a deep dark red colour, you're probably aware. You can see this liver is deep yellow colour because it's suffused with fat. Now, a great example of a fatty liver comes from the French culinary delicacy foie gras, which is created by force-feeding geese refined carbohydrates in the form of high-starch cornmeal. Fatty liver can develop in these unsuspecting creatures in about 10 to 14 days. In humans with excessive fructose intake, a fatty liver can develop within 2 months. So let's now look at fructose. Fructose is that 50% of sugar which gives sugary products their sweet flavour. It's not recognised as a foodstuff by the body. It doesn't trigger the release of insulin. It actually suppresses our appetite control system. And when it's absorbed into the bloodstream, 100% of it's taken up by the liver, and about a third is converted immediately to fat. So it's actually much more dangerous than glucose in giving rise to a fatty liver. Now, this is a picture of a normal healthy liver. You can see the densely packed cells there. And this is a fatty liver. You can see it's distended, and those white spaces are cells which are full with fat. Now, it takes on average about 13 years for someone to develop type 2 diabetes after they initially become insulin resistant and develop a fatty liver. It's a complex metabolic process, but ultimately what happens is that the liver can take no more fat in, and so the fat is then exported away from the liver as triglyceride, which is actually harmful to our health. And it's the high blood triglyceride level combined with the high insulin level, which then leads to the formation of fatty plaques, which block the blood vessels and in turn gives rise to the many life-changing and life-threatening consequences of type 2 diabetes. So the complications can be due to blockage of fine blood vessels or the larger blood vessels. So blockage of the fine blood vessels can lead to impotence. It can lead to numbness, tingling, pain in the extremities. As I mentioned before, it can also cause damage to the retinal tissue and bleeding inside the eye. And one of the other things it can do is cause what we call macular edema. Now, the macula, as I showed you before, is the central vision area of the retina. And this is a picture of a patient with type 2 diabetes. The top image is the right eye, and you can see the scan through the tissue of the retina on the right side. That's the way it should look. And the one below, you can see that little mound at the very centre of the central vision area, which was swelling, which is due to damage to the fine blood vessels of the central vision area, causing leakage of fluid into that tissue and then distortion and drop in vision. And when we see this complication, we need to treat it. And the treatment these days involves injection of an antibody into the eye. This is a picture of one of my patients receiving an injection. And the idea of the injection, or the substance we inject, seals up those leaky blood vessels, allowing the fluid to be reabsorbed, hopefully the vision to improve or at least stabilise. Now, what's interesting, if we look at this graph from 2016, when we first started using these injections, through to the end of last year, you can see the steady increase. And this really mirrors the growth of type 2 diabetes over the last few years. But you'll also notice last year, over 93,000 injections were given in Australia in 1 year. And this year, I suspect we may be up around the 100,000 mark. So 100,000 injections every single year, which really shouldn't be happening at all. So the other thing that type 2 diabetes can cause is dementia. Now, something like 70% of patients with type 2 will ultimately succumb to dementia. Now, having lost a father to dementia, it's a devastating thing, not just for the individual, but also for the family. So diabetes is something that actually impacts on the entire family. So damage to the major blood vessels can also have far-reaching impact. This is a picture of patients having renal dialysis. So the other thing that the type 2 diabetes can cause is kidney failure. And so when the kidneys fail, the blood needs to be filtered artificially. And we do that by hooking the patient up to the renal dialysis, sometimes up to 7 hours a day, 4 days a week. And I've actually calculated that every year in Australia, something like 4.5 million hours are spent patients with type 2 hooked up to a dialysis machine. So this is time lost to family and friends, to their work, and to the things they love to do. So not a great way to spend your life, is it? So damage to the major blood vessels can have far-reaching effect. The second most feared complication after loss of vision is gangrene. And this is a patient who's got a gangrenous foot due to blockage of the major blood vessels to the extremities. Of course, such a foot needs to be amputated. And every year in Australia, over 4,000 amputations performed for patients with type 2 diabetes. And here's our friend Neil Hansel, the guy that I introduced you to at the beginning, in his hospital bed in March this year, the day after his left leg was amputated for his gangrene. In fact, it was the 9th amputation that he had over a 14-month period after he'd gone blind in both eyes. He's also had 2 heart attacks. So type 2 is also a deadly disease. In fact, 80% will die of a thrombotic complication, such as a heart attack or stroke. It's said to be now the 6th biggest killer in our society, but if you realise that it actually plays a critical role in stroke, dementia, heart attack, the top 3 killers in our society, it also has a very important role in hypertension and in cancer, then type 2 may well be the biggest killer in our midst. And if we look at the current situation, in the first few months of the COVID pandemic, there was about 102 deaths Australia-wide due to COVID-19. During that same time period, over 5,000 deaths due to type 2, deaths that went largely unrecognised and certainly unheralded. And this is also a phenomenally expensive disease, costing our health system close to $20 billion every single year in terms of the treatment of diabetes and its complications, lost productivity in the workforce. But if we also factor in those other diseases I mentioned, I suspect the cost is many-fold more than $20 billion, probably closer to $100 billion. So how did all this come about? Now, humans are hardwired to love and seek out sweet things. It's an ancient survival mechanism that helped our early ancestors to survive extended periods of fast, which were common in early humans. It also allowed them to avoid bitter and potentially toxic substances in their environment. Prior to the 1600s, sugar was an expensive commodity. It was the domain of healers and holy men, and an indulgence that could only be afforded by the wealthy and the powerful. Over the next 300 years, the rising availability and popularity of sugar due to the booming sugar trade led to diminishing costs, turning sugar from a luxury item to an everyday necessity. These days, sugar is cheap, and sugar is absolutely everywhere, isn't it? Things actually took a turn for the worse in 1980 when the Dietary Guidelines for Americans was released. It was actually noted in the decades after World War II that there was a rise in heart attacks, and it was thought that this was due to a fatty diet causing fatty blockage of our coronary arteries, on no scientific evidence whatsoever, no strong scientific evidence. And so the recommendation of the guidelines was then to reduce our fats to 30% and up our carbs to 60% to replace. And rather than see a downturn in heart disease soared, along with it type 2 diabetes. In fact, in that 40 years, There's been a 4-fold increase in type 2 diabetes globally. And this has been even more profound in some communities and countries. In China, for example, there's been more than a 10-fold increase in type 2 diabetes in that same time period. And this is somewhat paradoxical because the Chinese diet is high in refined carbohydrates in the form of white rice. But what we've noticed in Asia in recent years is the rising sugar consumption, amounting to about 5% every single year. And this has also been devastating to the Aboriginal people of this country. There's been an 80-fold increase in type 2 diabetes over the past 40 years. I find that absolutely staggering and deeply concerning. And I've no doubt that a diet high in sugar, refined carbohydrates and highly processed foods is driving this. And if you look at the Australian Guide for Healthy Eating for Aboriginal and Torres Strait Islander people, it's got the same refined carbohydrate products, the same products with lots of sugar in it. And there are also some areas of Australia, lower socioeconomic areas, where type 2 diabetes is a real problem. And just one example is Greater Western Sydney. And you can see the red areas, which equate to Greater Western Sydney, are the areas with the highest prevalence of type 2 diabetes, up to 15%. In fact, in Greater Western Sydney, half of all adults over the age of 24 have either pre-diabetes or type 2 diabetes for the first time in our history. And interestingly, also in America, 50% of adults these days have pre-diabetes or type 2 diabetes. Again, very concerning. And we're now seeing this disease in our kids. This was a disease that used to be called maturity onset diabetes. There are now over 1,100 Aussie kids and teens with type 2 diabetes. And this is actually a worldwide phenomenon. In 2001, less than 3% of all cases of diabetes, type 1 and type 2, less than 3% was due to type 2. 10 years later, it's grown to almost half. And we have now close to 40,000 young adults with type 2 diabetes. And this is a real concern going forward. It's been estimated that we'll lose $3 billion in GDP by 2030 in the next 10 years due to lost productive life years. And what's really disturbing is we're now seeing type 2 diabetes in kids as young as 7 in Australia. In fact, there's a famous case from the United Kingdom of a 3-year-old child with type 2 diabetes due to excessive sugary drink intake. Unbelievable, isn't it? So what are we going to do about this? So if we're going to call type 2 diabetes a dietary disease, then surely there's a dietary cure. Surely it'd be as simple as reducing our intake of sugar, refined carbohydrates, highly processed food. It should be as simple as that. But there are a number of confounding factors that make it a more difficult thing to achieve. And I came up with this concept earlier in the year when I was thinking about the whole world of type 2 diabetes. I came up with what I call the 5 A's of sugar toxicity. And these are addiction, alleviation, accessibility, addition, and advertising. So I'll go through these each in turn. So firstly, addiction. Sugar is highly addictive. It's been shown to be as addictive as nicotine. Its consumption activates a reward centre in our brains, leading to the release of the neurotransmitter dopamine. It's what makes us feel good, it's what makes us want to do it again, and it's what gives us those cravings. And like drugs, the more you consume, the more you need to give you that feel-good hit. So it's a vicious cycle that becomes really difficult to break. Second A is alleviation. We often use sugar to alleviate stress or to make us feel better when we're down. When we're stressed, the brain triggers the release of the stress hormone cortisol. And the brain needs to balance that reaction up by releasing feel-good chemicals such as dopamine. And so sugar, of course, does a very good job of that. Third A is accessibility. I mentioned that sugar is everywhere in our lives. You can't walk into most service stations without being confronted by a wall of confectionery. And you certainly can't check out from most supermarkets and stores without being enticed by sugary drinks and chocolate. 90% of all food at checkouts in Australia is junk food. And 30% is on sale in any one week in the major supermarket chains in Australia. Fourth A is addition. Astronomical amount of sugar is added to our food and drinks. Something like 75% of our food and drinks have added sugar. And this becomes particularly problematic in remote Aboriginal communities where sugary food and drinks are readily abundant, often quite cheap, as opposed to the fresh and healthy foods which are expensive and quite often scarce. And finally, advertising. Our world is flooded with ads and TV commercials sometimes in the most insidious and predatory of ways. And this has been going on quite literally for decades. Okay, so what are we going to do about this? How are we going to deal with this? Well, to me, it's going to take resilience. When I talk about resilience, I like to use the analogy of Mr. Spock from Star Trek. He's a very cool-headed and resilient character, isn't he? I know what he'd do. He'd look to the smoking epidemic to see what's causing its decline. Back when Spock first graced our screens in the 50s, smoking was socially acceptable. In the years after World War II, something like 80% of men smoked cigarettes. And have a look at this ad from the 50s for candy cigarettes and the caption, "Just like Dad." The realisation of the health dangers of smoking in the 60s, the subsequent banning of advertising for cigarettes, taxing of tobacco products, and the rollout of hard-hitting awareness strategies such as these that we all know, have all made smoking socially unacceptable. And as a result, smoking-related diseases and deaths are on the decline in most countries. Not so sugar consumption, type 2 diabetes, and its complications, which are on the rise. So we're going to have to engage the same resilient approach in dealing with the 5 A's of sugar toxicity. So for addiction and alleviation, it's about being personally aware, being aware how addictive that sugar is and that we're using it to alleviate stress. This is something I didn't know until about a year ago. And for the other 3 A's, it's about accountability of businesses, industry and government to do the right thing by the people of Australia. So let's look at addiction. I suspect much of the world is addicted to sugar. I certainly was, and probably still am. The thing I love the most is ice cream. The bigger, the better. The worst punishment I could receive as a child was to be sent to my bed after dinner without ice cream. And there's rarely been a day since when I haven't had ice cream. But I got a bit of a shock earlier this year when I found out that I have a fatty liver, and this is a report from my scan. I had a fatty liver. And here it is. It gave me a bit of a shock. You can see I'm pretty thin. I'm what they call toffee. Thin on the outside, fat on the inside. And what's really interesting, one equates type 2 diabetes with people who are overweight or obese. But actually, there are more thin, metabolically unhealthy people in the United States these days than there are fat, metabolically unhealthy people. And I suspect the same may also be at play here. So what did I do? I immediately went into a sugar detox earlier this year. I gave up the heavily sugared products. I gave up the soft drinks and fruit juices, the chocolate and confectionery, the biscuits and cakes, and sadly the ice cream as well. And day one, the symptoms hit. It's quite dramatic. I don't know if any of you have tried it, but it's quite unpleasant trying to detox from sugar. And I wasn't going hardline on all the sugary products. So day one, headache, irritability, clouded thoughts, fatigue, much tougher than a coffee withdrawal. And the cravings were intense. And over the next 3 days, they really built up. But then they started to ease off. And after day 3, started to manage. And these days I can now walk past the freezer after dinner and not have to leap in and grab an ice cream. But I don't want to be preachy about this. I'm certainly not hardline. I still want to be able to go out to dinner, and we're going out to dinner tonight actually, so maybe we'll have a dessert. I still want to be able to do that every now and then. I still want to be able to receive a Haig's mint chocolate frog for my birthday. I still want to be able to have the occasional ice cream, just not every single night. And for me, it is a physical dependency, but I suspect for many people, particularly in poorer areas, there may be a much deeper psychological component to their addiction. And so we may need to engage helplines and self-help groups and psychological counselling, as we've done for alcohol and nicotine addiction. Second A, alleviation. Rather than reaching for that block of chocolate when you're feeling down, there are a lot of healthier options. Go for a walk out in nature, somewhere beautiful, or a cycle, or a run. Listen to your favourite musical playlist. Do a good deed for someone else, someone who's having a tough time. These have all been shown to be as effective as sugar in countering that cortisol reaction that's flooding our body during anxious times. Third A, accessibility. And there are a number of strategies that we can engage here. And we'll just go through a few with you. This is 2 vending machines in our Women's and Children's Hospital. I took them only a couple of weeks ago, packed to the brim with sugary products in the lobby of the Women's and Children's Hospital. I've since written to the Women's and Children's, seeing if they will remove those. These are 2 vending machines in the study area of Adelaide Medical and Dental School, Adelaide University's Medical and Dental School. This was just a couple of months ago. Again, packed to the brim with sugary products. I've since written to the Dean and asked, can we remove them? In fact, I've written to all the major universities saying, shouldn't we remove the sugary products from our vending machines? At this stage, I only heard back from UniSA who are planning to do something about it. So I think at Flinders, we can explore that as an option. I think that would be a really good thing. And another obvious thing would be to remove the sugary products from checkout counters where they're preying on our addictions. They're preying on the vulnerable, and they're preying on our kids. And once again, I've written to all of these businesses, all the major supermarket chains. I've actually met with Coles and Woolies, and at this point in time, nothing happening. This is a checkout counter at Foodland in Norwood, and I was delighted to see recently some nuts at one of the checkout counters. Wouldn't that be a nicer thing to see than these checkouts which are just loaded with half-price soft drinks and chocolates? 4th is addition. I don't know about all of you, but I can barely read those nutritional labels on the packets of foods, let alone understand them. And they certainly don't tell us the amount of added sugar contained within. I think we need a graphic front of label indication as to the amount of added sugar. We actually have a 5-star rating system, or a health star rating system, which is actually flawed. It's flawed because it's voluntary. At the moment, about 30% of businesses actually put the rating on foods. So what manufacturer would put a low-level rating on a product that's trying to sell? It's also flawed because a number of inherently unhealthy products actually get a healthy rating. The algorithm was designed to do that. And orange juice is one of those. A glass of orange juice gets 5 stars, and yet a glass of orange juice has almost as much sugar as a glass of cola, believe it or not. And this is where the contentious issue of a tax on sugary drinks come in. You heard from Jonathan, they talked, actually the thing when I received the award earlier the year, I was in Canberra, the political journalists were all fascinated by the idea of a sugar tax, and that's all they talked about. So it was Dr. Muecke calls for a sugar tax. But as you can see, this is a much broader strategy that we need. It's not just about a sugar tax, but this is where the idea of a sugar tax comes in, and there's actually some good reasoning and solid evidence behind it. In the 10 years leading to 2017, the consumption of sugary drinks in this country increased by 30%. Sugary drink consumption has been definitely linked to type 2 diabetes in many studies. And in 17 countries to date, a levy on sugary drinks has been shown to reduce purchase and consumption. So it certainly makes sense to me. And it's been modelled that a 20% levy just on sugary drinks would raise over $600 million, which could be then used to fund health awareness initiatives and health inequalities that exist in our society. And a recent poll has shown that something like 77% of Australians are actually in agreement with this. So finally, advertising, and once again, a number of strategies. I'm sure you can think of some. One of the obvious ones would be to remove ads, TV commercials for sugary products, which are aimed at our kids during those hours where our kids are watching. Also, the predatory marketing of sugary products on social media, which are aimed at kids. Removing sugary products ads on government buildings and services such as buses and trams. And we need to see a strategy, a far-reaching strategy to broadly raise awareness amongst the Australian public of the multitude of dangers of excessive intake of sugar. Not just type 2 diabetes, but also dental caries. Sugar is the leading cause of tooth decay in our society. 40% of 10 to 12-year-olds have caries in their adult teeth. And it's actually the leading cause of surgical admissions for kids in Australia, and the leading cause of days off school. Something like 50,000 days lost every year for tooth extraction due to dental caries. But I also want to leave some positive messages here, because there are some positive messages. Type 2 diabetes is a preventable disease. People need to be made aware of this. But also, very critically, type 2 diabetes is also potentially reversible in many. In fact, there are now 3 methods that type 2 diabetes can be at least put into remission. There are now over 100 controlled clinical trials to support a low carbohydrate diet in reversing or putting type 2 diabetes into remission. And this is just one example. 56% in 10 weeks. Over half of the patients were able to reverse their diabetes. This has been sustained now out to 2 years. And this is with a low carbohydrate diet, and also in patients who've had type 2 diabetes for at least 10 years. So this is not something just for early diagnosis of diabetes. And we seriously need to review our Australian dietary guidelines. This document is flawed and it's been severely conflicted by industry. Severely conflicted by industry. Someone said to me the other day, I didn't even realise we had dietary guidelines. Well, we sure do, and they're very powerful. They actually inform what's eaten in schools, childcare, aged care, hospitals, the Defence Force and prisons. And people don't want to go outside the dietary guidelines, so they stick within those guidelines because they're there. But they also inform our army of health providers, health educators, government policymakers, and the food industry. Quite literally thousands of products, low-fat products, have been made as a result of the dietary guidelines, demonising for the last 40 years natural saturated fats in our diet. But what's really important, actually it's also, what's very interesting is that even on the Diabetes Australia website, these are the words, people with diabetes should follow the Australian dietary guidelines. So type 2 diabetes is a disease of carbohydrate dysfunction, and yet Diabetes Australia is recommending that people with diabetes have lots of carbohydrates. The dietary guidelines are a high carb, promoting lots of carbohydrates, and this is exactly what people with diabetes should not be eating. The dietary guidelines themselves say that they are intended for the average healthy person. But in Australia, over 2/3 of adults are overweight or obese. 2/3 of adults over the age of 24, and probably close to 1/3 of kids are overweight or obese. So you can see the average Australian, unfortunately, is not healthy. We actually don't need guidelines for healthy Australians. We actually need guidelines for unhealthy Australians. We need guidelines for people who have insulin resistance, who are pre-diabetic, or who have type 2 diabetes. And this is another very important point, the natural saturated fats in our diet, the fats that we find in products such as what you can see there, but also whole-fat dairy, unprocessed red meat, eggs. These substances, these foods have been demonised for the last 40 years, but there's no evidence whatsoever to show that they're linked to cardiovascular disease. Such critical information that we all need to know. And we should be encouraged to eat real food rather than this heavily, highly processed junk food that we're currently eating. In the United Kingdom, something like 50% of the food that's eaten is ultra-processed foods. In the United States, 62%. And Australia, I suspect, is somewhere in that realm as well. But we also need to see some hard-hitting strategies like we did for cigarette smoking. A couple of years ago, I created a short TV commercial for Sight for All, and I'll play that for you now.
I should have kept my medication up, and I should have followed the plans that were given to me by my doctors. I woke up one morning completely blind. Thought I was dreaming, went back to sleep for an hour, woke up and I was still completely blocked off. My wife's face when we went to bed. That was the last clear image I had.
It's pretty powerful, isn't it? So that ad played for about 6 weeks on Channel 7, late 2018, nationally, but it played as a community service announcement, so it was probably only seen at 2 o'clock in the morning. So those sort of ads we need to see across all channels, during prime time, and for extended periods. To me, it's all about education. These days, would you leave a pack of cigarettes on the kitchen counter for your kids to enjoy? Absolutely not. So why would we leave a bowl of sugary treats? We need to exchange that bowl of sugary treats for a bowl of nuts, for example. We need to educate our kids. And yet we can't educate our kids until we know and understand ourselves. Now, how about those soft drinks in our fridge? Perhaps this is their gloomy future. Perhaps soft drinks, like smoking, we need to make socially unacceptable. I'm just going to leave you with one last message from Neil Hansel from his hospital bed the day after his left leg was amputated.
I had a little joke the other day, and I put my hand up and I had a grain of sugar between my fingers, and I said, "Meet my killer." And people were trying to see what was in my fingers, and all it was 1 grain of salt, 1 grain of sugar. And that's what it takes. You know, as a society, we have to do something. We've got to make people aware that the more sugar we intake, the worse this is going to get. And it's not good. It's not good.
It's not good, is it? As an eye specialist, I never want to again see another patient go needlessly blind due to their diabetes. As doctors, as health practitioners, we shouldn't see the life-changing, life-threatening complications of a dietary disease which is largely preventable. And as Australians, I truly believe it's time to put an end to type 2 diabetes. Thank you very much.
Thank you, Dr. Muecke, and I might hand over now to Professor Fran Bohm to give a vote of thanks.
So, well, thanks, James. I would like to thank you for your very insightful lecture. And what's really impressed me is you've taken us from the organs of the body right out to society. And I think all my colleagues in the Southgate Institute will really join me in congratulating you. You did not talk about behaviour once. So very well done. You didn't say people need to change their behaviour and make sure they eat less sugar. You really have shown us an appreciation of how the diets we eat reflect all these social processes that happen. I would like to suggest that you add affordability, so you have 6 A's. I think Paul made a good point there. And I was really pleased that you mentioned the issue of Indigenous people, because we know that through the processes of colonisation where we've introduced refined diets, whereas before that, as I'm sure Uncle Lewis would tell us, Aboriginal people were eating very healthy bush foods and foods that maintained them well. So it was really good to hear you mention that. I think it's also, you mentioned just in a way I was thinking, well, the level of type 2 diabetes in a community actually tells us how well a society's going. You know, and you showed us how much money we're spending just to treat diabetes, how little we spend to prevent it. You know, it's absolutely tiny. And we create a society where people have some people, particularly those people you pointed out who are on low incomes, have very little choice but to develop diabetes because they can only afford that diet. So I really want to thank you also for giving us an important role model of a medical practitioner and, of course, a surgeon, no less, who is able to move from their specialist knowledge about the body, in your case the eyes, and look out to that broader societal picture, because I think that's really important. And at our College of Medicine and Public Health, we have a social accountability mission, and I think you've shown us very well how you can move from your clinical role to really being socially accountable for the medicine that you do. So I think that's been really fantastic.
Thank you.
And really, we're very honoured to have the 2020 Australian of the Year to be our orator this year. That's really fantastic. And I guess I'd also like to thank you for giving such a key public health message, and also for using your position as Australian of the Year to promote that message. I watched the Australian of the Year ceremony, and I must admit, I thought, oh dear, a surgeon's becoming Australian of the Year. And then you stood up and you talked about a sugar tax, and I thought, oh my goodness, you know, he's giving a public health message there and he's really using that. So thanks for doing the oration, and thanks for all the work you're doing as Australian of the Year.
Thank you, Fran. That's really kind of you. Thank you.